Last year's flu season was severe, the worst in nearly a decade. Pediatric deaths jumped more than 60%, with 8 deaths in Florida, and roughly 80% of Americans' young flu victims were not vaccinated. Today, UF Health Shands Hospital kicked off its prevention efforts for this season. We sent Mary Grace Scully to learn more about the vaccines available.
Would you like your left arm or your right arm?
Flu season is back, and UF Health is rolling up its sleeves to face it head on.
Not only do we want to keep our patients safe, but we also want to keep our staff safe and also our community safe. The best way we have to do that is to get our flu shots.
The hospital requires every employee to get the flu shot, so to beat the flu before it hits, they provided free shots this morning at work.
It's so easy to get your shot. It takes just a few seconds. It's virtually painless. I barely felt it. And, you know, it's a lot better than the alternative, which is to be potentially really ill.
Infectious disease physician Nicole Iovine says it's important to get the shot before others around you show symptoms.
As soon as you get that shot, your body does start to respond. We say 2 weeks is when you have your full response, but during that 2 weeks, you are mounting more and more of an immune protective response. So it's really never too late to get the flu shot.
But when getting the shot, there are a few options to consider.
The most common shot that is given out has 4 strains in it, which covers the 4 most common types of flu strains that circulate. It is also in the nasal vaccine that also has the 4 different strains. The nasal vaccine is what is being used this year in the Alachua County public schools as part of their vaccination program.
There's also a high-dose 3-strain flu vaccine recommended for people over the age 65. One thing the shots have in common, they cannot make you sick.
It can't give you the flu. It cannot, because the virus is completely dead.
The CDC recommends everyone get the vaccine before the end of October. Mary Grace Scully, WUFT News.